Hi, this is Dr. Amit Kochar, and this is a PNI Minute. What are the treatment options for facial paralysis of the upper, middle, and lower face? With patients who have facial paralysis of the upper face or eye, they typically have a low-lying eyebrow, which is otherwise known as brow ptosis. This can be treated with a brow lift, and depending on the severity, different approaches can be performed. Patients may also have difficulty closing their eye. This can lead to excessive dryness and possible exposure injury. To prevent this, we can do numerous procedures, including placing an eyelid weight under the skin that will help you close your eye. We can also perform lower eyelid procedures called a tarsal strip to help improve your eye closure and prevent injury. For patients who have mid-face paralysis, they often complain about difficulty breathing. The nasal breathing can be improved with several options, including static slings or other surgical procedures that sometimes involve rhinoplasty. The mid-face can also be lifted through an endoscopic or an open approach to improve symmetry. For patients with lower facial paralysis, our goal is to improve your smile and help you communicate better to others. Depending on the length of the facial paralysis, there are several options. For patients with complete paralysis that has lasted less than 1 year, these options include using a nerve graft from somewhere else in the body or a nerve transfer from another nerve close by. An example of this includes using the nerve to the masseter, or the muscle that helps you chew. You can also use the hypoglossal nerve, or the nerve that is responsible for moving the tongue. If your paralysis is complete and has lasted over 12 to 18 months, you may be better served by performing something called a tendon transfer or a gracilis-free muscle transfer. The latter involves transplanting tissue from your thigh with a muscle, an artery, a vein, and a nerve, and inserting that into the face to help recreate your smile. This is a complex surgery that requires several days in the hospital, but offers the benefit of healthy vascularized tissue being transplanted into the face and can potentially offer you a spontaneous smile in the future.